Hi, this is Nicole Kupchik, and I'm here with my 10-minute tidbit show. Today, I'm super excited. I've got Kathleen Vollman with me. Hi, Kathleen.
Hi.
So Kathleen is amazing. She's a clinical nurse specialist who I've been following since I've been a brand new nurse, and it's just so cool to be able to sit here and chat with you.
Well, I'm excited to be here, and as a fellow ClinSpec.
We just so you guys know, we have like a secret pinky shake that we do, and clinical nurse specialist together. But we're here in San Antonio at the Society of Critical Care Medicine conference, and I was so excited to be able to grab Kathleen because she is an expert in so many things. Sepsis. You've done so much work in pressure injuries, early mobility. You actually devised a proning device. This is so cool. And I'll never forget, in the 1990s, you had this device. It was called the Vollman proner.
Yes.
She's like such an innovator. And so one of the things I want to talk with her about this morning, to share with you, is the work that she's done around oral care. You've done a ton of work.
Well, and I've been fortunate to have some colleagues that have done some great research as well.
Okay.
But oral care and cleaning the mouth, part of it started just because it was important to have good oral hygiene for the patient, and I didn't like the crispy critters in the patient's mouth. And
well, you all know what we're talking about. So.
And the nice stat swish and swallow at every bedside. So in 1992, when I was at Henry Ford Hospital in Detroit, I brought oral care into my entire hospital because I recognized that my patients in the MICU came from the floor.
So you really were an early innovator in this.
Yeah,
because I don't think the rest of the world really started caring about, not that we didn't care, but recognizing it as important until much later.
And then the vent oral care came in the early 2000s, and then I was fortunate. I have a colleague, Barb Quinn, in Sacramento, who I had done some consulting there on sepsis, and she had a nurse in the ICU approach her about why aren't we cleaning the mouths of the non-vented patient.
That's a great question. Right?
And Barb basically said, I don't know, let me go check. And it has led to some phenomenal work showing with a comprehensive oral care program for everybody in the hospital, whether they can do it themselves or not. They've had a 70% reduction in hospital-acquired pneumonia.
Seriously?
Yeah.
So even in their non-vented patients, that's impressive.
Yeah. And they've also, so when you combined it, so they have a therapeutic toothpaste, ADA-approved toothbrush, therapeutic mouthwash, and a mouth moisturizer, and the self-care patients do that 4 times a day. Then they have a scaled-down kit for those patients who can't do it themselves on the wards. It's 4 times a day. The ICUs continue to do what the ICUs have done. And they have denture care as well. And the other piece that they added, once they implemented that, they also added CPC rinse pre-op.
CPC rinse?
Yeah, it's an anti-gingival, anti-plaque solution that's in Procrest, but no alcohol.
Okay.
Even though some of our patients may like the alcohol. And so they started it in the pre-op area and then continue oral care throughout, and they've had a 75% reduction in post-op pneumonia. Yeah.
That's super impressive because I know, I think so many of us, we get some assistance from respiratory therapy when we've got vented patients, and then once the tube comes out, they're kind of done with the picture, and you kind of just wonder if this is just something nursing should just completely own.
I would agree. It belongs to us.
Yeah.
And the thing is especially in the ICU, oral care is not that sexy.
No. We're not bringing sexy back with oral care.
but to me, it's very sexy in the fact that I may, if I don't do a vasoactive drip right, I may cause harm right away. Yeah. But if I don't clean the mouth, I cause harm in a week or 2.
That's a really good point.
And so we have to raise the value and the priority of those fundamental care practices. They have a lot more science on them. And she got her protocol approved by the American Dental Association.
Seriously?
So it's the first acute care oral care protocol.
Wow, and this is Barb Quinn out of Sacramento. Barb Quinn, if you're listening, awesome work.
Yeah,
that is
done phenomenal.
Amazing.
Yeah.
And where could people find She said she published her.
Yeah, American Journal. So her original work was done in the Journal of Nurse Scholarship, Sigma Theta Tau's journal, and she just published the national study of the epidemiology. It's called the HEPI-2 study, and that just got published in the American Journal of Infection Control, and they got interviewed by the Wall Street Journal.
Now if the Wall Street Journal's
so they hit the Wall Street Journal for cleaning patients' mouths.
Yeah, but I mean, that's so impressive, and this is all nurse-driven.
Yes.
That's so impressive.
And she's launching it in her entire health system. She's working with the state of California. And nurses are picking up the work and replicating it all across the country.
That is so impressive.
So she's made such a CNS, too.
She's a CNS from Pinkies. See? Okay, so one of the things I want to ask sorry, we're getting a little goofy together. So one of the things I would love to ask about, where are we now with chlorhexidine? Yes, no, I mean, there's been so much confusion lately about chlorhexidine. Well,
I would say in terms of the science, the strongest science is on the CABG population, the open heart population. The meta-analysis, it sat on the positive side, but just right on the fence. And part of that is the fact that the majority of the studies were done with just chlorhexidine, not the comprehensive oral care in between. And so I think that's why you saw positive and negative studies.
Got it. Okay.
Because it really, a lot of this has to do with getting into the mouth, cleaning and suctioning, so that's not available for microaspiration.
Oh, fascinating.
Because the concept is 50% of us as normal individuals microaspirate when we sleep. Oh, so by the way, you can do your own curbside diagnosis if you've ever woken up and went, then you microaspirate when you sleep. So brush your teeth before you go to bed.
All right, who out there is microaspirating?
So the overall concept is would you rather aspirate clean stuff or dirty stuff?
Clean, please, clean. I'll take clean.
So that I mean, the science is as simple as that. Wow. So even with the head of the bed up at 30 degrees, you still microaspirate. You just do it at a slower rate.
Wow. So maybe we all need to get orthopedic beds at home. I actually have one that goes up to 30.
I just have big enough pillows. That raise. Yeah.
So it wasn't it was quite a when you look at chlorhexidine and maybe the meta-analysis, it wasn't a homogeneous population.
No.
Okay, fascinating. Okay, and I think these are the details, you guys. This is why you need to read beyond the abstract, the problem
and the discussion section.
Yeah,
you got to get into the guts.
Seriously, and this is why you need to read beyond just kind of the basics of a research paper to find, look for these details that definitely make a difference. So, okay. All right. So bottom line, oral care, do it on everyone.
And it also, you have to make sure that the tools that you're using are therapeutic. A lot of hospitals in the med-surg environments, the toothbrush I would only use on the grout in my shower. And
it's true. Your gums are all bleeding.
And the toothpaste has no therapeutic benefit whatsoever. Fresh Mint or Sparkle Fresh. You really need something that has anti-gingival, anti-plaque, Arm & Hammer baking soda, toothpaste.
So also cheap some of the companies that we're using in the hospital,
no, it doesn't work. And there are companies that supply to acute care that have therapeutic toothpaste.
Can you say the names?
Yeah, well,
just so we know.
Sage.
Okay,
Sage has a therapeutic toothpaste that's actually been tested by the dental literature, as well as in acute care. And so their products are the only ones that actually have been tested in both the dental and in the acute care environment.
Yeah, and Sage has really led the way, I think, in so many
fundamental
areas.
nursing care practice.
Absolutely, yeah. Okay, and then what about the toothbrushes? Does Sage make a toothbrush
They make an ADA-approved toothbrush. So what you need to look for is a smaller head and soft enough bristles, enough firmness but enough softness. The head is really important because of trying to get it in the mouth.
Sure.
The other important thing, and this is something that Barb learned during her implementation, is it was important to engage the nursing assistants for ownership and pride of this. And they even got a 30% reduction before they educated the RNs just by having the techs and the nursing assistants take ownership. But part of what they did was get all the tools and they brushed each other's mouths. So they got comfortable.
Fascinating.
They got comfortable getting in other people's mouths, because that's not a comfortable skill.
Absolutely.
And so they busted the barrier by doing it with each other.
Wow. And and I think nursing assistants, techs, a lot of aides, they really, I think it's one thing to say, brush somebody's teeth 4 times a day, but it's quite another to say, you're doing this because we're going to reduce pneumonia or aspiration, or, not that you're reducing aspiration, but you're, again, clean aspiration.
The risk. Right, you're reducing the risk.
That's huge. I think that's absolutely huge.
Well, and those nursing assistants, I mean, to today, you walk in there and they will talk about the pride level they have of what they've done.
And if you know why you're doing it, it makes so much more sense, and you get buy-in.
Yeah.
Okay, so, well, Kathleen, I want to thank you. You're absolutely amazing. I adore you. I love you. She's one of the best CNSs. So, all right, this is Nicole Kupchik, and this is 10-Minute Tidbits.